Okay, welcome to the THMA Professional Development presentation. This is February 25th, and we're very excited to have Vivasay with us tonight. We have Alexa Tassopoulos. No, I can't get it right. Um, Tassopoulos is the Regional Sales Manager for Ontario at Vivasay Canada. With over a decade of experience in the medical aesthetics and medical device industry, Alexa brings a deep understanding of both the clinical and business realities faced by today's aesthetic practices. She holds a Bachelor of Commerce from York University and remains actively involved in the healthcare community throughout her volunteer work with South Lake Regional Healthcare Center's Patient and Family Advisor Committee. Approachable, knowledgeable, and highly engaged, Alexa is committed to being a trusted partner to healthcare professionals and their teams as they evolve their practices with confidence and care. Our second presenter is Sheila MacKay. Sheila is a highly respected cosmetic injection specialist with over 20 years of experience serving in the Ottawa area. She specializes in advanced filler contouring and facial rejuvenation, neurotoxin wrinkle treatments, PRP, and mesotherapy. Known for her precision artistry and clinical expertise, Sheila has had a profoundly positive impact on both her patients and the aesthetic industry. She has been a clinical trainer with HA Injectables since 2001, supporting Canadian national distributors and mentoring peers across the country. Sheila is a licensed RN in both Ontario and British Columbia. Dedicated to excellence, Sheila believes continuous education is essential to delivering the most effective and innovative treatments. She regularly travels internationally to stay at the forefront of aesthetic medicine. She's a regular attendee of MCAS, Anti-Aging World Conference, FACE Conference UK, and other symposiums and trainings. The latest being a special invitation to the prestigious Train the Trainers program hosted by Vivasay in France. So welcome to the both of you. We're very excited to have you with us.
Thanks, Tracy.
Thank you, Tracy. We're happy to be here. And we're going to start with basically some new marketing material from Vivasay to give everyone a taste of what Vivasay is about. Okay. So Tracy already introduced myself and Sheila, so I'm going to skip through this part. And we will go right into talking first a little bit about Vivasay. So Vivasay is a French manufacturer specialized in the design, manufacturing, and distribution of hyaluronic acid-based medical devices. All of our products are made in France. And Vivasay was born in 2007, but we actually have a history of innovation that goes all the way back to 1987 at a laboratory called Cornell. And this laboratory was actually creating an HA gel for ophthalmology. And there was a specific doctor that was using a lot of this gel. And the scientists at Cornell went to this doctor and said, okay, what are you doing differently? And he admitted he's putting the product in the patient's dermis to restore volume and hydration that they were losing as they were aging. And that is essentially how monophasic dermal filler was born. And that product was later marketed as our name Juvederm and sold to Allergan. And then those same scientists decided that they had some ways that they wanted to evolve and innovate on that original formulation. And years later, in 2007, that was the birth of Vivasay Laboratory and the inception of the IPN-like cross-linking pen. Since then, we have expanded globally, launched other product lines internationally, and expanded really into all the major countries globally. So we're in 95 countries around the world. And across Europe, we are considered the #2 most recognized brand across healthcare practitioners, and #1 in many European countries in terms of dermal filler. We have sold more than 20 million syringes since 2017, which is very exciting. And then also we've more than doubled our revenue as a company between 2020 and 2024. And this just speaks to the rapid growth that Vivasy has experienced internationally. We have 3 global offices. Our marketing and sales is in Paris, France. The manufacturing site is in our Champs, which is sort of French countryside. It's about 25-30 minutes from Geneva, from the Geneva airport. And then our international distribution is in Geneva, Switzerland. This is our original production site with an expansion that occurred in 2020, giving us new offices, training facilities, and also what we call like the VIP floor, where we will bring in VIPs from around the world. They can actually have a tour of the manufacturing site, which is the clean suite. We get you all ready in scrubs and things like that, and take you through to see the production of the facility, or of the product, sorry, at the facility. And then also there's a private training suite where we bring in international key opinion leaders to train our customers as well. And it's very like idyllic and beautiful French countryside.
Yeah.
And then in 2021, we decided that wasn't big enough. So we built a monster of a production facility right off the Archamps Highway, more than doubling our production capacity. And this was also in anticipation for the rate of growth that we were expecting, but also entering into some new markets as of 2025. And these production facilities are not only beautiful and they're fun to visit, but they also hold a Class 3 CE marking for the devices there and the highest level of ISO sterilization across Europe. So we're very, very proud of that. I believe it was about 2015, France came forward and said that if you're going to manufacture these types of medical devices within France, you need to up your standard. And every other manufacturer left the country except for Vivasy. So we're now the only dermal filler that is being manufactured there in accordance with this high level of ISO sterilization. We also have a very rigorous, high quality control system where every syringe is manually inspected to make sure that there are no imperfections at all. And the actual raw hyaluronic acid that is sourced that goes into the Stylage dermal filler is of the highest grade possible that we can source internationally. So what that means is safe product that also gives you less chance of adverse reactions and any issues that could happen for practitioners. In addition to our amazing production facilities, we also have quite a presence at major scientific congresses around the world, including MCAS, which is probably the biggest one because it's in Paris. We're platinum sponsors there for us, and we take up quite a bit of space at MCAS. And also AMWC, Dubai Derma, and FACE. In addition to our presence at these congresses, we also have a great digital presence, including our website, vivasy.com, and the Vivasy Academy, which is a free online learning portal I encourage everyone to go to. It has pre-recorded courses, webinars, and all of our clinicals are available there as well. And anytime you see Vivasy International hosting an international webinar, it is always done through the Vivasy Academy. In addition to this, we also have the My Vivasy app. This is unique to Vivasy. We're the only company that has an app that you can download. You can actually scan an NFC tag that's on the sticker inside the syringe, and it will tell you, it'll bring it up, that yes, your product is authentic. Yes, it is still shelf stable. It's within that period of time, and there's been no recalls or issues. So you get all that information just by scanning the sticker inside the syringe. This is a video from actually just a couple weeks ago at MCAS Paris of our presence there. So it was our booth, but then also we had a private suite for educational seminars. And on the Vivasy Academy, and also at some of these international congresses that we participate in, we have a very strong lineup of some of the best of Europe in terms of KOLs, many plastic surgeons, dermatologists, aesthetic doctors that are well regarded. And I'm very proud to say that we now have a very strong group of Canadian key opinion leaders, many of which we just brought to MCAS Paris and were on stage for us, including Dr. Jean Carruthers and Dr. Hanny Sino, leading the way, talking about Stylage on a global stage. It was very exciting. So overall, before I go into the Stylage portfolio, the main takeaway I think that is so important is that as much as Stylage has been available within Canada for since 2017, I really feel like starting this year, 2026, we've become a brand new company in Canada, thanks to the leadership of Allison, our national sales director, and her amazing strategy for the company here. But also, we have really this amazing offering in Vivasy International, our presence and the science and technology that goes into our products. We're now really finally able to bring that fully to Canada, and likewise also bring what we are doing here in Canada overseas and putting that on an international stage. So it's a really exciting time to be at Vivasy, and I'm very fortunate to be part of the team. Any questions before I move on about Vivasy? Okay. So now I'm going to talk about Stylage. Stylage is a line of hyaluronic acid-based dermal fillers manufactured by Vivasy. And what makes Stylage unique? Well, really, there are three things if you want to break it down. And the first thing is the IPN-like technology, which is a unique patented cross-linking technology. I'll go into more information about that. The next is the addition of mannitol in all of our products. Mannitol is, Mannitol is an antioxidant that's often used surgically to reduce swelling, and we've actually put it in our product, which is increasing longevity, but also safety for our patients. And then the third is the BiSoft injection technology. That is the actual design of the syringe. So first, we'll talk more about IPN-like technology and what that is. So IPN-like technology basically means that we have a monophasic dermal filler, which is strands of hyaluronic acid, which is cross-linked with BDDE, which is the agent that gives longevity to dermal filler. But unlike other monophasic products on the market, we have two monophasic networks, network A and B, and they are connected with an electrostatic bond. And basically, it acts like almost a magnet that's attracted to its opposite end. So they come together, and this allows us to actually have lower levels of BDDE in our product. It also allows us to really fine tune each matrix. So within each matrix, we are able to fine tune the HA molecular weight, the HA concentration, and also the degree of cross-linking. This gives us the ability to create an ideal rheology or elasticity viscosity for each product or each indication. The next piece is, as I mentioned, Stylage has the addition of mannitol, which is an antioxidant. And this antioxidant is added to the product, not just to reduce swelling post-injection, which happens anytime you put a needle in someone's face, but actually to protect the hyaluronic acid gel. We know that during the inflammatory process, free radicals come to the site and they actually start to, they're scavengers, or they start to break down the hyaluronic acid gel. The mannitol is able to delay this process, protecting the gel and allowing it time to actually integrate with the tissue. This gives better tissue integration with our product. Patients love it because they have less swelling, less bruising post-injection, but it's also very important because it gives a more natural overall result. And what you see is what you get when you're injecting Stylage. Sheila, did you have something to add here?
So the other benefit of mannitol too is as soon as you inject, typically you can feel the product. And this is something where you have to adjust your thinking when you're using Stylage. When you inject, because of the mannitol, its main purpose is to prevent the degradation of the product immediately. It's your body's natural reaction to create that inflammation and protect it from something foreign. But with the mannitol, because that's not happening, you can touch the area right after the injection, and the area isn't edematous. It is soft, it's smooth, and you can barely even feel where your product is because it's so calm. The benefit of that as well is that it's not putting stress on the tissue. We all know inflammation ages tissue, so this is actually keeping the skin a little bit healthier and putting less trauma on the tissue while you're injecting.
Yeah, that's a great point. And there are clinicals that back exactly what we're saying. So better overall protection of the HA with mannitol, less degradation of the HA, so you have more longevity of your treatment. And then also showing that with the mannitol, you're reducing inflammation post-injection. And then the third piece that is really a patented technology that makes Stylage unique is the syringe itself. The syringe is a patented technology, as we call it bisoft injection technology. It was designed by injectors for injectors, but it gives better precision, comfort, and control when you're injecting. So overall, it has an optimized center of gravity. It fits beautifully in your hand. It allows you to inject, or sorry, when you're injecting, to aspirate with one hand. And 97% of practitioners that were surveyed were extremely satisfied with the syringe. Sheila, you've been using this syringe for a while. Do you have anything to add?
You know what would be, it's unfortunate we don't have a slide comparing it to another syringe because from the picture it's beautiful, but the plunger is nice and large, so you can inject with your thumb or you can use the inner portion of your hand. So when you have a busy day and you're getting tired, especially if you have smaller hands, it allows you to be very maneuverable. The phalange itself twists as well. So if you've inserted and you need to reassess the area, you can always twist your syringe to make it more comfortable too. Plus, it's a short and stubby. So you stand closer to the patient, and standing closer to the patient allows you to control and allows you to be more precise with your injections, especially if you're using a cannula, because then you're standing about a little bit further apart. So the short syringe is really, really comfortable. It allows you to stay close to the patient, allows you to stabilize your hand, and the plunger itself does not bend. So when you're injecting larger amounts, there's a full, beautiful control the whole way through.
Yeah, great points. So those are the three specific things that make Stylage unique in our patented technologies. But we also have more than 20 scientific publications for the Stylage range, proving safety and efficacy. And those are all available for you to review on the Vivacity Academy. A few takeaways from some of these clinicals that I always like to touch upon is Stylage has excellent biointegration. So a study showing at 2 years that Stylage was superior to the competitor for actually integrating with that tissue. And that gives overall more natural results. It's you're not able to feel the product in the tissue, as Sheila had mentioned before. And patients are normally happier overall with that sort of outcome.
Can I just add to that
Yeah,
too?
yeah, of course.
Less risk of migration.
Yeah.
So because it is integrating into the tissue, it's not just sitting under the skin or in the skin, it's actually becoming part of the tissue where it's been injected. It's not moving. So after a day, you don't have to be concerned that it's going to change its shape or it's going to move from where it's been injected. That's the cohesivity of the product too.
Yeah. And also going back to the mannitol piece that we talked about, Stylage XL induces less inflammation compared to the control and also the competitor, measured at 24, 48, and 72 hours post-injection. And we know that that is when the inflammatory process is at its highest, is within that time period. So for both Stylage S and Stylage XL, reduced inflammation compared to other products and the control as well. And as I mentioned, patients love this. It mitigates that swelling and inflammation right away. It helps the treatment be exactly what you see is what you get. But also it's great because, as we mentioned, it's also protecting the tissue and allowing the product to actually integrate into that tissue. And the third one is the Stylage range is among the most cohesive range on the market. So Stylage L, this is a great visual I always find because you look at Stylage L and that beautiful thread, and it stays exactly together. Beautiful elasticity that way. And why this is important is because if you have a cohesive product, you have better integration, but you're also able to achieve a more natural outcome for your patient with less product.
Yeah.
And all of that is great, but the most important clinical for any provider is patient satisfaction. Happy patients are reoccurring patients. So we have a clinical showing that 97% of our patients had assessed either that their treatment 12 months post-injection was good or very good. And to me, I've been a patient myself with other products with Stylage.
You have?
I have. I've dabbled before in filler and getting a few things corrected. It's a habit of the industry. And I can speak to my own experience. And sometimes I absolutely loved my injection when I was in that chair day one, and I was so happy. But then how that product reacts down the road, how does it degrade, what's the longevity of it, all of that matters. And I'm in the industry, and still sometimes I wondered, was this the product or was this the injector? And I can only imagine if I wasn't in this industry, my immediate assumption would be, okay, I'm just going to go somewhere else next time. So it's very important overall to have happy patients. And I think we can all agree on that. Now, I'm going to start to review the actual Stylage range. So within Canada, we currently have a full range of dermal filler. starting with S. S is our softest product. It is used for fine lines, often used for a subtle lip, or superficially with a cannula for skin quality and hydration. One of my favorites is for sort of those static fine lines that you can't get otherwise. Neuromodulators aren't quite working. So 16 milligrams of hyaluronic acid, as I mentioned, it's a very soft product. And it was originally designed to be actually a tear trough filler, so it can be used for that as well.
Yeah.
For a patient that it's indicated for. Then moving on to Stylage M. M is sort of your workhorse product. It is got 20 milligrams of hyaluronic acid. It is for medium lines of the face. So your nasolabial folds, marionette lines, really beautiful for chin shadows. I've seen it. It's really, like I said, it's the workhorse. In Canada, very well known for lips, for sure. It's a beautiful product. It can create height in a lip like no other product I've ever seen. So really, really thankful to have that in our lineup. And then Stylage L, I consider this your moderate volume product. So beautiful for a little bit of structure and volume in the mid face. It has 24 milligrams of hyaluronic acid, and its indications for skin depressions of the face. And S, M, and L all have a 6 to 12 month duration. So on kind of line with a lot of the other products in the market. Then moving on to XL. This is our volumizing product. We have 26 milligrams of hyaluronic acid. It's used for the cheeks, cheekbone, chin, temples, but really that volume restoration where you're lacking volume, or you're trying to correct that lack of volume. Then moving on to Stylage XXL. This one's a little bit unique. As you can see, we're actually going backwards. We only have 21 milligrams of hyaluronic acid, and it is meant for augmentation of facial contours. I like to think of it as a liquid implant because it can really act just that way. It is very forgiving. It's still moldable. It's still flowable, but it really truly acts like bone once it's injected. And both Stylage XL and Stylage XXL have a 12 to 18 month duration. So well above industry norm or average, which is really great. Especially, I
Sorry
was
to
going to
interrupt,
say,
but I think the only ones on the market that can last that long as a pure HA.
yes, exactly. And I think now that we're moving towards really treating the patient, not just like we're filling wrinkles, like we were talking about earlier, Sheila, but we're addressing the facial structure. We're augmenting facial features to really harmonize the face.
Yeah.
And when you are doing that, you tend to get into a multi-syringe treatment. So to be able to grab a product that has a 12 to 18 month duration, you can say to the patient, this is, it's going to last you a little bit longer. And it feels like more of an investment, because if you say 6 months, that can feel a little bit of like a sticker shock.
It's the foundation.
Yeah, exactly. So we talked about each product, but this is just a quick overview, a little bit more. Sheila, I don't know if you have anything you wanted to add.
So again, the products were designed for tissue. So it's not being indicated for you must use this in a cheek or you must use this in a lip. It really is versatile. So if you have the patient that comes in and only wants one syringe, how do you know what to pick? The small, medium, and large, those are your traditional type of fillers. Of course, small is injected more superficially, but if you need to go a little bit deep, onto the little wrinkles on the cheekbone, but you don't want to bulk up a cheekbone and create too much contour, you can chase that with small. Medium is the universal. It can go anywhere pretty well on the face. You can bolus it, you can fan it, you can use the cannula for it. Lips especially beautiful, folds, wrinkles. It's a gorgeous product and it has great elasticity. and helps the more mature skin give it extra support as well. So it moves with the face. It doesn't look heavy, which is really,
Mhm.
really nice in natural areas. Large is a gift. Like this product is it's very special because it bridges the gap between our contouring and our filling. So again, depending on a patient, you can use this to create a little bit of an apple or the apex of the cheek. You can use it for a mandibular angle, but you can also use it in the oral commissure, and you can put a little bit in a lip too. Our only products that can't go in the lip are the XL and XXL. They're just too robust, they're too thick, and they are like an implant so it wouldn't move nicely in a superficial skin.
Yeah, yeah, well said. And XL and XXL, do you want to speak to these?
No, I'm just teasing.
I
Yes.
was going to say, if you don't, I will, because they're
Oh
my
my
favorite.
gosh. These are what sets this line apart. Like there is nothing like it. And 18 months for a pure HA with the mannitol so that there is minimal edema. There it has this beautiful contouring effect that doesn't need a lot of product. It doesn't masculinize a feminine face by making it look heavy or square. It doesn't change after it's been injected. And you can't feel it. Like it's amazing. Patients love it. They come back for it. And the fact that if patient doesn't like it for whatever reason, it's reversible. You don't have to be concerned about x-rays or it not being visible, or you can use hyaluronidase. So the safety factor of these products, but what they can do to create that injectable implant and those sharp angles that most women and men are looking for these days, it's beautiful.
Hmm. And
Temples,
yeah,
noses, cheeks, jaws, chins.
yeah, and I like that you touched upon the fact that it is reversible. And as I mentioned when I reviewed the cross-linking technology, because of the IPN-like technology, we actually have lower levels of BGE, but still amazing longevity of our products. And we all know that less BGD is better overall for our patients and for the tissue. And it's also better when you're dissolving a product because you can do so faster if you were in an emergency
Yeah.
situation.
And for men, XXL, for thicker skin or acneic skin, again, you can get sharp contours, whereas before products wouldn't be strong enough to create those nice angles. So it really is a beautiful tool. Something if you haven't tried it, these two are very, very special.
Yeah, thank you. No, we're great points to add. Um, So overall, the advantage of the Stylage line is that you have great ease of injection with the IPN-like technology, increased cohesiveness because of that technology as well, and good integration of the product into the tissues, and high longevity. We have product that outlasts any other HA dermal filler on the market. And because of lower levels of BDE, great tolerance for our line as well. So low levels of complications from that.
Mhm.
Getting into some before and after images. This before and after image is the use of Stylage superficially to address static lines and wrinkles. It also helped to address skin quality in this patient. We know that hydrated skin is healthy skin, and hyaluronic acid also helps to induce collagen synthesis. So placing Stylage helps overall with the skin quality, and I think this patient looks immediately 10 years younger for sure. This is Stylage M being used to treat the nasolabial folds in this area. Beautiful results without looking puffy, without looking overdone. And even for this patient, slightly deeper lines. And Stylage L was the product of choice, and still beautiful, beautiful results. And Stylage XL on the cheeks here to give better projection. You can see the heaviness of this patient's face just looks so much more
Yeah,
with after. And this is one of my favorite before and after images because
this is beautiful.
it shows really how a little bit of product in different areas can, when you're profile balancing, can just bring out someone's features so beautifully. So this patient, yes, they had Stylage XXL on the jawline, cheekbone, and chin. Um, I believe she's also had a little bit of product on the nose and the lips here as well. And overall, the profile balancing just brought out her features. She looks stunning, and just like a more feminine, younger version of herself. Okay, so now that we've talked about Vivacy, we've talked about Stylage, and some of the clinicals and before and after images of the portfolio, I want to pick on Sheila just a little bit. Because I don't know if everyone knows who Sheila is, but she has been in the industry for quite a while. I don't know if everyone caught that during Tracy's intro. But I feel like she has so much wisdom and experience to share with everyone. So I thought it'd be fun if I interviewed her a little bit. So, Sheila, I hope you enjoy this, but you've been injecting for over 20 years. What
Yes.
originally drew you into aesthetic medicine before it became what it is today?
Wow. Okay. So, I pretty well fell into it, to be honest with you. Back in the late 90s, I was working in a hospital, and the hospital shifts were changing to 12 hours, and I had a little baby.
Mhm.
So I could do that only when my husband was available because daycare was hard. So I ended up having an opportunity to work with a dermatologist in Ottawa. Dr. Sharon Laughlin was a leader in laser therapy and a real expert in her field. And so I was able to get a part-time job working with Sharon, and that was my intro to this. We assisted her with collagen at the time. We had to do collagen testing to have patients have injections first, and they'd have to wait a month, and collagen would last 1 to 3 months. And at the end of my stint with Dr. Laughlin, QMed brought Restylane to Canada. So that is when we first were exposed to a hyaluronic acid. Um, after uh, Dr. Laughlin, I then went to work with Dr. Antoniak, who was a surgeon. So my background was always interested in surgery. Dr. Antoniak was an ENT cosmetic surgeon. He had his own operating room. So I jumped on board of that opportunity. So I had a chance of working with two both very distinct and highly respected doctors at the beginning of my career.
Yeah. And I can only imagine. I think back to when I started in aesthetics, and I feel like we've come since then. And you've got 10 years on me. So, yeah. Yeah, I can only imagine.
Yeah.
So, my next question to you is, can you share a mistake or complication in your career that shaped how you inject today?
Okay. Safety first. And only ever do what you're comfortable doing. There's the words of wisdom. So let's put this into perspective. So when I started, we had collagen, which was an animal byproduct. That's why we had to do allergy testing. And then came Restylane, Perlane, lasted up to 6 months. We were thrilled. So move ahead to the mid 2000s, and American patients would come up to Canada because always, even then, their dollar was better. So, and insurances weren't worried about international patients at that time. So February 8th was the date. I don't remember the year, but I remember the date because my doctor at the time was off skiing. And patient came in just to do parallel lines, a little bit of lip. Oh, it was also great. Did I mention she was the wife of a physician from the US? And then at one point, she's just at the end of the syringe, she's like, how about we just touch up this little glabellar line? Absolutely. Forgot that she had had Articol, which was a permanent injectable at the time in that area 3 months prior to. So with my little bit of product, of filler, I touched up a very fine line. That was the end of the syringe. I turned around to grab a gauze and looked, and she had blanched all the way up her forehead following her vessel. And I had never seen anything like this before. So this is before hyaluronidase. We didn't have hyaluronidase at the time because we were only treating wrinkles and we didn't know about these complications. So we compressed the area right away and started to massage. I had one of my colleagues call the doctor, um, tried to stay calm, tried to calm the patient. I'm like, any pain, nothing at all. And thankfully, with warm compress and massage, the skin just became pink again. It was just a pressure on the vessel that we were able to massage out. And she didn't even have a bruise. But that was my lesson to always, always, always double check what has been injected on the face, the patient's history. And I do not touch the glabellar with anything other than Botox to this day.
Yeah, that's a great learning lesson. I'm sure has shaped many of your decisions going forward.
Yes.
And a great takeaway for new like injectors now that sometimes, it's best to be safe, safety
What
first, right?
always,
Yeah,
always, yeah.
always, yeah,
Only do what you're comfortable doing.
yeah. Um, and so another question to you. When you approach a face today, what is the first thing that you assess before ever picking up your syringe?
Okay. Good. Yeah. So again, facial assessment has completely changed, right? Like when traditional fillers HAs first came to Canada, we were doing fine lines, wrinkles, folds, and lips. That was it.
Mhm.
Those were the only indications. Thought processes beyond the perioral and lip did not exist. And it wasn't until the field started to expand and we started to assess the face differently, we started to inject differently, and then the demand on the products changed. So no longer
Mhm.
could we just use the traditional fillers for volumization. They would migrate. They weren't meant to be injected into the deep derm or into onto periosteum. So we had all these areas that became bloated or over injected because you were using products that didn't really work. So today, what I like to do when I'm starting with a patient is look at them as soon as they come in and sit in my chair. And we have a discussion. And I watch how their face moves. I watch how they animate. And then I watch them at rest. And then, so I have a mental plan of, okay, here are some of the deficiencies. Here's how someone is aging, or here's what their concerns are. And from that, each and every time, the plan changes. And as nurses, we all know we have to address care plans on an ongoing basis, and they aren't something that should be stagnant. So each time the patient comes in, we take time to assess, to talk, converse, and take a look at what bothers them. So full facing, starting from the temples, is there volume loss? Is it bone loss? Is it weakness of the tissue? And what's the major concern of the patient?
Yeah, very, very good. And I feel like when I started in the industry, I felt like everyone was chasing wrinkles. And I'm so proud of where injectors are today
Yeah.
and really addressing the deficiencies of the face and what has changed and not necessarily just listening to the patient saying, oh, well, this line bugs me. And then, okay, well, we'll put some product right there.
Or
So,
my last inpatient does my cheeks, so do my cheeks. And it's like, well, we have to talk about harmony and we have to talk
yeah,
about balance. And we also, I think what I've learned from really great injectors is knowing when to stop.
yeah, it's
And
true. And when,
sometimes the patient's like just one more. And you're like,
Mhm.
we're gonna sit this one back and wait a couple of weeks because you don't want to distort someone's natural beauty or the shape of their face.
Yeah, no, it's very true. And that kind of brings me to my next question for you is after all these years, what would make you say no to a patient?
Hmm. Well, okay, so let's start medically first, because you always want to look at the patient's medical history. So if there's contraindication, that's a big no-no. So that's
Mhm.
that's easy. Um, unrealistic expectations.
Yeah.
That one's a little bit challenging because there are patients that come in and they're like, "Oh, I want this," and you're like, "Hmm." So you have to know how to tread that line of the motivation. Is it something they want? Is it something their partner is telling them they should get? Those are red flags for me, for sure.
Yeah, that makes sense for sure. Okay. Well, thank you for all that information. Like I said, you've been in the industry for 20 years. You have so much experience and knowledge. So thank you for sharing a little bit of your experience and background with the
Thank
group.
you. Well, thank you for asking.
No, it's great. Do you want to review the first case you have for us this evening?
Sure. Sure.
Perfect.
So these are patients, a couple of patients that we brought in to show you what the product can do in clinic. And I'm going to say this patient, for instance, we used one syringe. So would I have liked to have done a full global harmonization for this patient where I'm treating everything I would like to? Absolutely. But here is a 62-year-old woman who has never had filler. Um, she's healthy, no contraindications. She came in and her biggest concerns were the little wrinkles on the corners of her lower chin area, so into the oral commissure. I'm like, we can do a little bit more if we just do a little lifting. And she's like, no, thank you. I think I want to start with this, and this is what my budget is. So I'm like, what do I use? This is a tricky area. There's muscle pulls. Can I use Botox? The answer is no. I'm just using filler. I'm like, okay, let's do this. So thick, heavy skin. Initially, I'm just like, okay, I could use small, I could use medium, I could use large. So I'm narrowing it down to because I'm going after wrinkles, I need to have something that I can inject into the deep derm as well as the derm. Because with those lines, I want to try my best to impress her and not scare her off. And I don't want to make her look even heavier. Um, at one point, I said, are you okay if I put a little bit in the corners of your upper lip so I can structurally help to support the corners of your mouth? And she begrudgingly said, okay, as long as it doesn't change the shape of my lip. I'm like, I promise you it won't. So I started with structure. I put on a 30 gauge needle. So I chose medium, and I chose medium because it's the most universal. I lifted the corners of her upper lip with about zero point 0.1 ml per side in a linear thread, vertical linear thread along the wet dry border. And I did a little bit of a J of a lift technique at the end, just to lift up the corners a tiny bit. This is her before picture. Um,
Mhm.
and then I ended up using a 25 gauge cannula. I went into the deep derm, into her lateral chin area, and just fanned underneath the areas that are depressed to help blend and support the fat area in that and blend her chin as well. And then I put a 30 gauge needle back on and started chasing those wrinkles, old school, just going linear threads into the wrinkles themselves. I did do a little bit of a lollipop technique just at the corners of her oral commissure, again, to structurally help support her lip. So the far right hand side picture is her before. The middle picture is immediately right after the treatment. So that's it. I used a cannula, I used needles, and you can see her needle pokes, but you can tell like her skin doesn't look any heavier. It doesn't look any, there's no bruising. Um, that was that. And so she was happy with that. She was comfortable with that. And then I had her come back. I'm sorry the picture isn't the same color. I'm not the best photographer. Um, in fact, her sister had to take that picture because she couldn't come back. She lives in Victoria. That's 3 weeks after. So that was one syringe of medium. That is your classic patient that comes in. I'm afraid I don't want to look done. Let's start with what bugs me. And she was thrilled. So one syringe, that's it. And she didn't have any bruising, no complications, and she was happy.
Yeah, I would say a great use of one syringe. Sometimes, patients sit down in your chair, and whether it be a budget restraint, or they just, it's their first time having filler. I get it. One syringe is sometimes what they're comfortable with. And I think you did a great job with a little bit of product in making overall a big impact on her face.
Yeah. Thank you.
Yeah. Case number 2, we have you here with our patient. Do you want to speak to this case?
Poor Jane. If you can, can you see how afraid she looks? Anyway, that was I at least I looked comfortable and I was happy that she was in my chair. So everything I will start by saying everything went beautifully. Um, Jane is a 57-year-old. Here she is. She is absolutely lovely. Medically, no issues whatsoever. Healthy female. She had had 3 treatments of Morpheus, but still lacked structure, and she felt she wanted a little bit more of a boost for her skin. She's concerned about looking tired and old, and first-time filler patient. I somehow managed to find 2. So Jane is she's athletic. She's a mother of 4 girls. So again, what she does is also very conservative. She doesn't want her daughters to think, you have to be happy with who you are and how you look, but she wants to have some rejuvenation. So everyone's fear is to be, if they've gone this far without having filler, they don't want to look done. They're afraid a little bit. So we did baby steps, and I'm like, we'll break this down into 2 appointments, but I've only had time to do one, so this is what we did. Um, we did a full facial assessment. Jane has never had Botox either, so we're not talking about that. So no neuromodulators here, only filler today. So we talked about the fact that she was losing her lips. We talked about the wrinkling around her mouth. We talked about a little bit of a pre-gel that was starting to happen, a little bit of bone density loss laterally along the jaw, and a little bit of volume loss in the mid cheek. So um, that is what we thought we would address. In total, I ended up using 4 syringes and a combination approach of products. So I did 1 syringe of large, 1 syringe of extra large, and then 2 syringes of medium. So in the mid-cheek area, with a 27 gauge needle, I went with large, was my choice, because I didn't want to create too much bulk. I wanted to keep her slightly depressed because she liked the look of her athletic face and she didn't need a lot of volume. So the large was a really beautiful, forgiving product that gave her a little bit of structural support. I did about zero point 0.3 ml into the cheeks bilaterally, and then ended up saving the rest of that syringe to do along the ramus, the lateral compound, the lateral bone of the mandible, just to create a nice angle. So that is where the large was used. Extra large was used into the mandibular angle itself with, again, a 27 gauge needle. I did a bolus technique down onto periosteum. I pinched and kept my fingers under the bone so that I could feel the product wasn't migrating. Nice and slow. It gave her a nice sharp point. From there, I passed a 22 gauge cannula along the top aspect of her mandible to fill out the body and help support the jowl. I then put a tiny little bit into her chin as well, just to help pull out the skin so that she had a complete jawline restructuring a little bit. Around the mouth and into the lip, I used medium. And again, I chose medium because you'll see from some of the other pictures, there was a depression as well as wrinkling. Her skin is thin and I don't want to bulk her up. So I could have used small, but I went with medium because structurally she needed some extra skin support. So again, I used a 25 gauge cannula. I fanned her lateral chin area up to the oral commissure, down to the mentalis to blend. And then I used a 30 gauge needle and went into her oral commissure. I fanned her upper lip with a 25 gauge cannula and went with a 30 gauge needle into the lips to create a little bit more shape. Okay,
Beautiful.
let's see. There's Jane. So her far left picture now is the before. Um, her middle picture, this is immediately after. So 4 syringes immediately after, she looks great. She has little red marks from her needles and cannulas. She doesn't have any indurations. She doesn't have any bruising. She doesn't have any hard areas. Everything looks pretty smooth already. Um, and then the picture on your far right is the 3 week follow-up. So Jane is thrilled. She was like, oh my God, my 21-year-old daughter said, Nurse Sheila can't retire because I will need her one day too. And was thrilled with the natural look of everything. She texted me the next day going, I can't believe I have a little bit of a lip again. And her jawline is spectacular. Her skin looks more healthy, and she feels great. Do we have any other? Oh, there it is.
Here's the next angle.
I'm getting ahead. I'm all excited. So there's Jane's before on a profile. There's right after. And then again, this is where the tissue integration comes into play. So you see the effects of the mannitol on her tissue post-treatment right after. It's calm. Her skin isn't irritated. She felt great. It was her first time. But 3 weeks later, the magic has kicked in. The product is integrated. There's more lift, and it's thank you. And it's just a nice natural result. I don't like showing, I don't like treating patients, I should say, when there are like 10 syringes being used. I find it's harder sometimes to get a nice result when a patient comes in, they're like, this is what I can do. And that's the reality of what we do. We have to adjust and be able to pick our tools to accommodate our patients and to give them the best results we can with what we have to work with, right? And set that expectation. So there's Jane before, Jane right after, and 3 weeks later. A little side note, and why I'm so proud of these results for Jane is her husband works in the Ukraine for our embassy. So she's gone to Europe as of last night to spend a couple of weeks with him. And so he's going to see his fresh looking wife after he's had a stint in the Ukraine for a year and a half. So anyway, that's a nice story. She was thrilled.
Amazing. Yeah, really, really great outcome from only four mLs, 4 syringes of Stylage. And the way that you sprinkled a little bit of product here and a little bit of product there, to me, it's done so beautifully. You did a great job.
Thank you.
Yeah. So to summarize a little bit about Stylage, we have a unique IPN-like cross-linking technology, the 2 combined HA matrices. We are the only product on the market that have a mannitol-enriched buffer, which is an antioxidant known for reducing inflammation, but also protecting the hyaluronic acid gel and giving longevity to the product. We have a complete range of products for every facial need within Canada. And we have, we're proven and recognized for our efficacy and safety with a best-in-class range of slow degradation, long-lasting results, high product tolerance. And as I mentioned previously, this is all supported by over 20 clinicals available on the Vivacea Academy. And we do have a unique patented syringe design that injectors love. It feels good in the hand. It's made for an injector. It's not an afterthought. And it's meant to make every injector's job just a little bit easier. So I want to thank everyone for joining us this evening and taking the time to learn a little bit more about Vivacea and Stylage. Thank you, Sheila, for sharing your expertise and some of the case studies you've been working on recently with Stylage. And thank you to Tracy and the entire THMA group. I want to open up the floor to questions, but before I do that and close my presentation, I'm going to leave this here. You can scan the QR code. This is going to take you right to the Vivacy Academy, or you can go to vivacyacademy.com. And as I mentioned, this is a free online resource with pre-recorded webinars, courses, our clinicals, and we also stream all of our live webinars through this portal. So please sign up, look at the different products, definitely filter for English. We are a global company and there's lots of French courses on there. So filter for English if that's your preferred language. And I appreciate everyone's time. So again, thank you, Tracy.